All right, we've roped in a Democratic Nursing Organization of South Africa's Deputy Secretary General, Khaya Sodidi. Khaya, very good afternoon to you. Just a few moments ago, during COSATU's commemoration of Workers' Day, Zingiswa Losi, in fact, talking about how austerity measures should not mean cutting nurses' jobs. As you reflect on this Workers' Day, what stands out for you?
Good afternoon, Unati, and to the viewers of SABC, and thanks for having us. Unati, what is happening is that, like you know, we all know that annually we do a mark or commemorate this day, is that we take stock of what the workers could have gained in the previous years, and then also what the challenges of the employees facing the employees today. Of course, we agree with the President of COSATU, in particular when it comes to the public sector, in particular health, that there should be no austerity measures that should be imposed against the health sector. So for us as DENOSA, we were encouraged by that, because that's a voice we want to hear all the time, that healthcare sector remains very critical, and if we have to impose any austerity measures, then it means that the patients and the citizens of the country will suffer further. So that message from President of COSATU, for us as DENOSA, we were very much in line with it.
I mean, following the COVID-19 pandemic, it became very evident just how crucial nurses are, and that they are, in fact, the backbone of the healthcare sector, as some had indicated. When you consider that statement and just the shortages in terms of budget, but even also working relations, where do you think the gap lies?
That is correct. We made a good example about the COVID-19 pandemic, which at that time our government showed us, which was encouraging, that they can intervene. During that time, they have managed to mobilize resources so that the nurses and the doctors could face the pandemic. But what is disappointing is that after 2 years, maybe later, after the pandemic, when things will look like they're going back to normal, our government, our department really didn't go back and then strengthen and continue in terms of putting more resources to health. So that's a disappointing part, that that was an opportunity that our department and our government should have continued to make sure that the health sector is being well resourced, and more so now with the NHI or implementation of NHI, that if these challenges, lack of resources, shortage of staff, they remain in place, then NHI really is going to become a dream that we will be ever able to implement. So that's a disappointing part. But what is clear, Unat, is that our department and our government, when they want, they can mobilize resources. All we see is that we need a political will, or there's no political will. Hence, we are faced with these challenges we are faced with today.
And Khaya, as we wrap our conversation, of course, the national budget has gone back to the drawing board. What would you like to see in the budget 3.0, as it's being termed?
We should remember, Unat, there was an attempt of the budget, which didn't happen. But if you remember, there was a midterm budget last year, whereby the Minister of Health, I think it was last quarter of the year, whereby the Minister of Health did indicate that he was not planning to cut or to impose any further austerity measures against health sector. So we're encouraged by those words. We're then expecting that when he comes back for the third time to present the budget, there should be no budget cuts from health sector. Instead, we're expecting more money. And also, President Ramaphosa was in our National Congress of DENOSA, which was held on the 25th to 28th of March, whereby he attended our Congress, and he made a commitment in our Congress that there will be no austerity measures, there will be no more budget cuts against health sector. Instead, they are thinking of or they are planning to give more money. So I'm being encouraged by those words. So we're expecting when the minister comes, we're expecting no budget cut from health sector, number one. All we're expecting is an addition of funds because we're in gross shortage of funds. Nurses and doctors are unable to do their work because there's just no funds available or allocated to do their job.
Khaya, thank you so much for your time. Really do appreciate it. Democratic Nursing Organization of South Africa's Deputy Secretary General Khaya Sodidi there as we reflect on Workers' Day.